Francisco, and today I am joined by the Department of Public Health. In place of Dr. Grant Koufax, we have Dr. Susan Phillips. We also are joined by the Director of the Department of Emergency Management, Mary Ellen Carroll, as well as our Police Chief, Bill Scott. And from the Homeless Services Agency, we have Abigail Stewart. Thank you all so much for joining us here today. And I just want to start by saying that I know that the last few weeks have been very challenging for families, especially parents with children who are no longer in school, and also especially kids who have not been able to hang out with their friends and do the things that, of course, kids love to do. I know that this has been very challenging for all of us, and especially for families, as you juggle to work at home, homeschool your children, and deal with the difficulties that we know have happened over the past couple of weeks, but more importantly, what we are going to be dealing with over the next month to maybe 2 months of staying at home and trying to abide by the order that has been issued. And we know that it is important that while children are at home, that they continue to access learning. For some, having access to a laptop and the internet is a luxury that other kids may not have. And so we also know that the school district has been working really hard to implement policies around distance learning that they are interested in launching within a week's time. And so what we have done in partnership with the school district and 2 nonprofit organizations, Education Superhighway and 1 Million Project Foundation, we are working together with them to provide free Wi-Fi or super spots in the areas where we know that they are needed the most, including in our public housing sites, our single-room occupancy buildings, community centers, and other neighborhood locations where students lack connectivity to the internet. And I want to also express my appreciation to the Department of Telecommunications that the department has been working with several public housing sites, and we know that at least in 6 of our public housing sites, there's access to free internet, including in the Bayview Hunters Point and Western Addition community. But we also know in places like Sunnydale and other locations where we have large populations of children who may not have access to the internet, this is going to be very critical to ensuring that they have the support that they need. The school district also, through philanthropy, has been able to purchase over 4,000 laptops, and we are currently working with the school district and the tech sector to secure an additional 4,000 or so laptops to support those students who may not have the devices that they need at home for the plans to launch distance learning. We really want to thank the Thomas Bravo. It's a private equity firm in the Bay Area which provided $2 million to the school district to help with this effort. This donation, along with others, will ensure real equity and will make sure that every kid in our school system has access to high-quality internet service as well as laptops that they need with the tools that they need so that everyone has access to learn during this very difficult time as we know it. It's really been amazing to see the community come together and so many people go out of their way to provide these level of resources that are instrumental to all children in San Francisco having access to tools to learn. And if you are interested in continuing to help in that effort, please feel free to reach out to us. I want to talk a little bit about the Small Business and Economic Recovery Task Force that was announced yesterday. I want to thank President of the Board of Supervisors, Norman Yee, as well as the 4 co-chairs of this recovery task force, Assessor Recorder Carmen Chu, Treasurer Jose Cisneros, the Executive Director of the San Francisco Chamber of Commerce, Rodney Fong, and the Director of the San Francisco Labor Council, Rudy Gonzalez. We know that the challenges that we are facing now as it relates to public health, that our economy will also be tremendously impacted. And as we struggle to provide resources to our small businesses and people who have lost their jobs, we also know that after this is over, because it will come a time where this will be over, that it is going to be necessary that we have a plan on how we as a city will recover. The fact is, we have all seen those very grim numbers released this week by the Comptroller's Office that estimate, we anticipate a $1.1 to $1.7 billion budget deficit over the next 2 years. And that is just early reports based on what we are seeing. We know this is going to be very difficult for all of us, and a lot of difficult decisions around our current budget and future budgets will need to be made. Our goal, of course, is to do everything we can to support our businesses in San Francisco, to support our city workforce. But again, it will be difficult, and there will be difficult decisions that need to be made. As a result, we brought together folks from labor, folks from the business community, and some of our elected leaders who are responsible for the finances of the city in order to develop a long-term plan of recovery so that we can hit the ground running on day one. We know that there are things that we need to do now, and we are focused on trying, in collaboration with the support that we are getting, hopefully, from the state and federal government. We know that there are other needs. And yesterday, we also announced a fund to provide additional $10 million to support our small businesses, where small businesses can request up to a $50,000 no-interest loan with a flexible repayment schedule. And we added additional monies to our grant program for small businesses as well. We know that in the stimulus package that was provided by the federal government that there will be resources for small businesses, but we also know that there's a lot of uncertainty, and we want to make sure that we're providing support and resources necessary to support our small business community and also to support our workforce. If you are a small business or if you are an individual who has financial needs, please visit our website, oewd.org. There's a lot of resources that are provided with clarity around what programs could be made available. We also know that the governor, as I've mentioned before, has extended the eligibility requirements for those who can apply for unemployment insurance. And so we want to encourage as many people as possible to apply. We want to make sure that people have access to resources. So if you have any questions or concerns or you need access to resources, please visit oewd.org. I want to talk a little bit about the announcement made yesterday by our county health officers in the Bay Area with a strong recommendation that people who are going out of their homes wear masks. And I want to be clear that, number one, this is a recommendation from our county health officers, and number two, this does not take the place of physical distancing. We want to make sure that people understand that the policy of social distancing has been put into place as a way to prevent the virus from spreading. And this is just an additional precaution that is necessary to help continue to flatten the curve as we continue to talk about what's necessary to do that. Additional recommendations will come into play. And I also want to be clear, and Dr. Phillips will talk about this a little bit later, but it is not necessary if you are not working in a hospital with patients who possibly have the virus, then there is no need for you to wear a N95 mask. We want to reserve those masks for healthcare workers. And so please continue to follow our orders around social distancing, and please continue to do everything you can to keep you and your families safe. The other thing I'd like to talk about today, as part of our public health response, we've been focused, as I said, from the very beginning on securing hotels in our city. And I want to be clear that our priority has to be public health. And so the system that we developed for acquiring hotel rooms has everything to do with that. We had a number of people who were in our hospitals, who were in hospital beds that didn't need to be in hospital beds. And with that particular population of those who have the virus, who do not need to be in hospital beds, and who do not have a home to go to or who live in congregate settings, we, through our hotel program, have provided hotel rooms in order to make sure that they are isolated from other members of the public for the recommended time of 2 weeks. And then the next step is to provide them access to one of our expanded shelter systems, like the one that is open in Moscone West. The goal, again, is to deal with public health and to make sure that our hospitals are not inundated with people who don't need to be in the hospital, because we need to preserve those beds for people who are really, really sick. There are people who have those symptoms and they are not in need of a hospital bed, but for those who are in need of one, we have got to keep our system clear to make sure that they have access to one. And so in the past, when Trent Rohr provided updates about the categories of people that will receive hotel rooms, I want to just reiterate, our goal is to serve public health and to provide access to hotel rooms for those who don't need to be hospitalized but have been tested positive with COVID-19. We also have plans to provide hotel rooms for our elderly homeless population, those who are over 60, those who have underlying conditions, and those who are in our shelter system now, so that we are able to practice social distancing in our shelter system now. So the goal is to really focus on this particular population, and that is exactly what we're doing. We also want to be clear that hotel rooms will be provided to our first responders, our healthcare workers who have either contracted COVID-19 or who do not want to go home in fear of transmitting COVID-19 to members of their families. So that's where we are as it relates to the hotel rooms. The rooms that we have secured so far have supported those folks. And I know that many of you hear Dr. Colfax talk about the surge and what's coming. And I just want to remind everyone, because people are wondering, well, when is it? What's going on? What surge? What are you talking about? I just want to remind people that when we declared a state of emergency on February 25th of this year, not one person was diagnosed with the coronavirus here in San Francisco, and now, today, we are at 497 people with 7 deaths. I know it's hard to trust the information we're providing when you can't necessarily see it. And what I want to say is it's important that you trust the decisions that we are making as to how we manage this public health care crisis. We have some of the best healthcare experts anywhere in the world, right here in San Francisco. UCSF, CPMC, San Francisco General is world-renowned for so many things, especially around trauma and saving lives. Our UCSF institutions and their research and the work that they do is world-renowned. And so we are working together to make sure that we have a system to address what we know, sadly, will be a situation where possibly all of our beds could be occupied, which could be very challenging to serve people who are in need of a bed. This is where our hotels will be very instrumental, because if someone does not need to be in a hospital bed and they are homeless, the opportunity to provide them with a bed in a hotel is so critical to their recovery and limiting their ability to spread it to other people. And it's important to making that bed available for someone who really is in need. We are focused on what is necessary to save lives. We know that there are a lot of frustration and emotion attached to what we know is a real homeless problem in our city. We are not going to be able to solve our homeless problem in San Francisco with this crisis. We cannot deviate from what information we have and what systems we are putting in place in order to address this challenge and really truly flatten the curve. This is our ultimate goal. And we are busy focusing on exactly that and doing everything we can to support the most vulnerable homeless population that is sleeping on the streets now. In fact, our goal is to really target those who are over 60 and those who have underlying conditions who are not yet in our shelter system. The ability to provide sufficient capacity for the expanded shelter bed programs, the hotels, the food, the cleaning, the management, the oversight, the work, the resources, the wraparound supportive services, all that we have to do to expand our capacity to address this issue is a very challenging thing to do when many of the folks that we have working in this field are already still showing up to work and still working very hard to help keep our existing programs running. And we have to also protect them. So this is more complicated than opening up every hotel room in San Francisco and making it available. If that were possible, we would do it in a heartbeat. But there are a lot of other things that come with doing this right. And ultimately, our goal is to focus on our public health experts and the recommendations there, and to do this in a way that truly provides the help and the support that we need to those who are most vulnerable in order to get through this. So I want to thank you all again for your understanding and your patience as we grapple with these challenges. And I also want to say, as the weekend approaches, today is Friday. I think it's going to rain. We see the sun is out. And I just want to remind people how important it is to follow the directive. And we are in week 2 of this stay-at-home order, and we know that it's not easy. When you're in line at the grocery stores, follow the social distancing order. When you are out and you're at a park or walking around your neighborhoods, please continue to follow the social distancing order. This is so critical to the success of our city. When you think about what is happening in San Francisco in comparison to places like New York, people are, the numbers in New York, sadly, have skyrocketed out of control. In the United States, have basically surpassed other countries in the world. And here in San Francisco, we have been able to really, I think, do a tremendous job in maintaining numbers that people thought would be completely out of control at this time. Yes, it will get worse before it gets better. Yes, we will have challenges ahead, but the reason why everyone is praising San Francisco for our swift action in closing down the city and looking at the numbers and what's happening is because everyone here knew how important it was to follow the instructions, and everyone accommodated the request for the most part in our city, and that is what's going to get us through. That's what's going to make us successful as a city. That is what's going to keep us safe because we know that when we come together and we work to follow the instructions provided, that we will get through this. And the last thing I want to say before I ask Susan Phillips to come up is, put positivity out into the world. This situation is like nothing that I think anyone alive today has ever experienced in their lifetime. And it can be scary for some people, especially people who are struggling financially and have a lot of uncertainty about their future. There's a lot of anxiety. There's a lot of frustration. There's a lot of fear. There's a lot of things that are going on in various people's lives and household. And what I think is important is that when we are going through all of this, yes, there's work that needs to be done, and the people here at the Emergency Operations Center are working every single day to do that work, to make things better for all of us. But at the same time, we need to continue to put out that positive energy, to put out that love and goodness in the world. An example is exactly what we know. Some neighbors gather and they just, open their windows or come outside the front of their places at, I think, 7 o'clock, and they just start clapping and thanking the healthcare workers. And we saw on the Salesforce Tower, there was clapping to thank the healthcare workers. We lit up City Hall in blue to thank the healthcare workers. I think that if we continue to put out positive energy and love and a feeling of togetherness and comfort, that is going to help us through. Because we can drown out all the negativity, all the hate, all the other stuff that divides us by focusing on what matters. This really has put so many things into perspective, even for me, and how short life can be, how precious it is that we are all here today, and what we can do with our voices, with our commitment, with our passion, how we can really demonstrate it by example and how we can help others get through it. And I want to bring up the note that I mentioned before that I received from a neighbor that just basically said, here's my cell phone number, here's my email address. If you need someone to run errands, if you need a grocery store run, the pharmacy, or even just someone to talk to, I'm here. And that means a lot. It means a lot to someone who may not have received a visitor this whole time. And so I just wanted to just remind us to be good to each other. The kindness of so many of you has gone a long way and really helped people get through it. Because when I say we'll get through it together, we'll get through it together when we support and uplift one another. That's exactly what we need to do as time goes on, because this is going to get even harder. And the only way we're going to get through this is really by trying to focus on supporting each other, uplifting each other, and just really trying to push for a more positive outlook on things. Because there will be a time that we will wake up and life will be back to what we know and love. And so at this time, I'd like to ask from the Department of Public Health, filling in for Dr. Grant Koufax, we have Susan Phillips, Dr. Susan Phillips.
Good morning. I'm Dr. Susan Phillip, Deputy Health Officer for San Francisco. Thank you, Mayor Breed. I'd like to update San Franciscans today on a few developments in our ongoing work to respond to coronavirus and protect our community. Today, there are 497 San Francisco residents with confirmed cases of coronavirus. 6 of them are in hospitals across the city, and about half of these are in ICUs. Very sadly, 7 San Franciscans have died from the disease. I'd like to send condolences on behalf of the entire health department to their families and friends. As we continue to fight the coronavirus pandemic, I'd like to remind you again, as Dr. Koufax has, that our top priorities remain reducing the spread of the virus in the community, protecting vulnerable populations, healthcare workers, and first responders, preparing our health systems for an expected surge of hospital patients, and expanding our testing abilities and capabilities. In all of this work, we seek continuously to do better as we incorporate the latest science, data, and facts into our actions and recommendations. We have known from the very start that this is a rapidly evolving situation, and that continues to be true. We're working very quickly to integrate new information all the time and adjust our recommendations accordingly so that we're providing the very best, most up-to-date information and advice that we can. The issues of masks and face coverings is a good example of how we've done this. Yesterday, Bay Area health officers joined together to recommend that members of the public cover their mouths and nose when they go outside to do essential tasks. Data shows that cloth face coverings, when combined with physical distance and hand washing, which we have always recommended, may prevent additional transmission of the coronavirus. The state health department issued new guidance this week as well. The key point is this: if you cover your face, you're protecting other people around you. We know now that people may be contagious before they have symptoms, or that people with coronavirus may get only mildly sick. You could be one of those people. I could be one of those people. Covering our noses and mouths with cloth is a good way of being a good neighbor and a community member. I want to stress that this is not a substitute for physical distancing, staying at home, and washing our hands. These remain the mainstays of our work in prevention, but it is an additional tool and one we should use. I also want to stress that medical masks, such as isolation masks or N95 masks, are still in very short supply and must be reserved for healthcare workers and first responders. A face covering can be a made-at-home cloth mask, a bandana, a towel, a scarf. Anything that will absorb droplets is just fine. This is new advice, and we know that there will be questions. There will be frequently asked questions on sfgov.org, and those will be continued to be updated. I also want to give an update on Laguna Honda. We remain very concerned about a growing outbreak at Laguna Honda Hospital and are continuing to do everything we can to protect the health of the residents and the staff there. We've gathered some of the best minds in infectious disease control to help us prevent and manage the community spread of this virus. We've had some of the world's foremost experts right here in San Francisco at the health department at UCSF, and furthermore, we're expanding to work with the California Department of Health and with other experts around the country. We're very grateful for this support. We also know that long-term care centers are at great risk across the country. So if we can make progress here, it will benefit people in other places. Experts from the California Department of Public Health and the U.S. Centers for Disease Control and Prevention are on site at Laguna Honda and will remain there to assist in the improvement and implementation of the highest level of infection control measures. They're also working very closely with us, advising how we should do contact tracing investigations and giving us recommendations for further improved preparedness and response going forward. We are all working together on a preparedness and response plan and protocols for all of the long-term care facilities in San Francisco. I also want to give you an update that as of today, Laguna Honda has a total of 12 confirmed cases of coronavirus. 10 of these cases are among staff and 2 are among residents. Of staff, 7 have been in patient care positions and 3 have not. As we speak, the California Department of Public Health and the Centers for Disease Control and Prevention are on site, again, helping us, as I mentioned, with contact tracing and investigations. To date, 94 patients have been tested throughout the hospital, and to date, 278 staff members have been tested, either by DPH or by their own provider. Every staff member on the 2 units where staff have been sick have been tested. Every patient on the unit where there was a sick patient has been tested. We are working with CDC again and identifying and testing those staff and residents they are most concerned may have had exposure to coronavirus. Some people have asked a very reasonable question. Why don't we test everyone on campus? In an outbreak situation, we must prioritize both clinical decisions and resources. The first people to be tested will be those who are showing symptoms or those who have been exposed to a person with coronavirus. The contact tracing investigations will tell us who these people are. Those test results drive further action and decision-making. We're committed to keeping you all informed about this progress. Testing has been taking place every day this week as the contact tracing investigations continue. Testing has taken place on the 4 South unit among patients who have displayed symptoms or have been identified as having risk of exposure. The CDC continues to advise us about additional tests on campus, and we will discuss with them and act on those recommendations. We've talked a lot at these meetings. Dr. Colfax and Mayor Breed have kept you informed about the continuing shortage of testing supplies. If we had unlimited supplies, we could do more tests. But even then, we would want to make sure that, again, our testing was informed by data, facts, and science. We've taken action in recent weeks to further mitigate the spread of virus on campus, including placing the entire Laguna Honda community under a preventive quarantine. This prevents community spread by having residents remain on campus and limits opportunities for the virus to be brought onto campus. We've stopped rotation of staff to various units and limited impacted areas to only the most essential personnel. We made the very hard but necessary decision in early March to restrict visitors on site. This week, in partnership with the CDC, we have escalated action to further decrease movement throughout the hospital and the campus to an absolute minimum to fight the outbreak and to reduce spread of virus. Laguna Honda is a very large campus serving 780 residents with approximately 1,700 staff. We've restricted access to the hospital by closing all but 2 entrances that are tightly monitored and controlled. Staff are medically screened as they enter and given a mask. Residents are not allowed to leave at this time. We've restricted access to any areas where residents may gather, including the library. Again, the California Department of Public Health and the CDC are providing much-needed clinical and epidemiological leadership and support to our own very strong DPH team to strengthen our approach, including the contact and tracing investigations, and we continue to test staff and residents based on their risk assessments. They've also joined the ongoing discussions about other long-term care facilities and how we can also help strengthen them and prevent outbreaks there. Laguna Honda is a top priority, and we are vigilantly working to contain the spread of the virus and protect the residents and staff that are there. We want to thank, again, everyone who has been involved in this very large and very important effort. These teams have brought knowledge and resource from their work all over the country and the world that's being shared citywide. We're very fortunate to have their help at Laguna Honda. Thank you. Now I'd like to introduce Chief Scott, who will say a few words.
Good afternoon, everyone. I want to follow the mayor's lead here and talk about the positives first. And I must say, overall, we've seen really good compliance in our city. We had really good compliance for the most part overall with social distancing last week. And this is thanks to, in my opinion, the proactive leadership of our mayor, our director of public health, and many other city leaders who jumped out in front of this. You know, we had some rain last week, and that probably helped as well, but this week has been a week of good weather, and we're still continuing to see, for the most part, compliance with our public health orders and our social distancing, but there are some challenges. And I'm going to discuss those in a little bit of detail to make sure that we all understand what's at stake here. There have been a couple of instances, or several instances rather, where we've seen social distancing challenges. We're talking about our public plazas in some parts of our city. We've seen, as this has progressed, we've seen people playing on playgrounds and playing team sports, soccer and the like in our parks. And thanks to our Director of Rec and Parks, Phil Ginsburg, we have closed many of those parks, so we're not having those issues. We're working as hard as we can to educate the public, and when I say we, I mean we collectively, the police department, city workers, the Emergency Operations Center has a community branch, and through the leadership of Mary Ellen Carroll and her leadership and her team, we've reached out to people to really give the education to the public about what needs to happen with this pandemic. And what needs to happen is we need to stay true to the social distancing that public health officials have mandated. 6 feet apart, no gatherings, social distancing when you go to stores that are deemed essential, grocery stores and the like, make sure you social distance and you practice those things. The last time I was in front of you, I predicted that there will come a time where we have to cite. And that time has come, and we have begun citing. And I'll make this very clear, particularly for the business owners in our city. And our mayor has done everything and continues to do everything possible to lighten the blow. And we know this is a drastic impact to people's lives and livelihoods. But we have to abide by these public health orders. We warned businesses, many of them, or several of them, rather, that they were non-essential. And when those businesses have been contacted, we've taken incident reports. Those incident reports can lead to either criminal or civil action. But if we have to go back, we're not going to ask twice. We've had to cite a business in the last 24 hours, and we've cited individuals in the last 24 hours. And these are people that have been warned before. So I'd like to ask again for the public's help and compliance. Let's help each other. Let's help ourselves. This is serious, and we need to abide by these public health orders. If we have to go back and you've been warned, you will not get a second warning. And we understand that not everybody is watching the news, not everybody has access to the internet or social media, not everybody gets a newspaper. That's why we're giving the benefit of the doubt, and we're warning and we're educating where we can and where that's appropriate. But as I said a couple of days ago, and I say it again today, we're not warning you twice. So please heed to these orders. We're trying to save lives, and we're trying to keep everybody safe and healthy. This weekend, it might rain. Right now, it's nice weather, and people want to go outside and get exercise, and we understand that, and we are respecting that. If you live in the same household, we're asking that you still practice social distancing, but if you live in the same household, the rules are a little bit different. If you don't live in the same household, please abide by the social distancing. I can't stress that enough. Please abide by it. You will not be warned. You will not be asked twice. Now, there are situations, and the city is doing everything it can. The mayor, our director of public health, our director of homelessness and supportive housing, we're all working together to really work with some of these impacted populations that don't have shelter, don't have a home. And we're being very, very patient, and we're educating as much as we can, but we still need you all, those individuals in those populations, to practice social distancing. This is really important, and I can't stress it enough. Again, we have begun to cite. We will not ask you twice. I think we've been extremely patient, but we want to stay ahead of this like we've done up to this point. We want to flatten that curve, and we want to save lives. And with that, there are a few updates that I have in terms of just the general picture of policing in the city. As we have reported, crime has been drastically reduced since the stay-at-home order was issued, and we're continuing to see that trend. For those people that have to go out, still be vigilant, be careful, social distance. We've had a significant drop in property crimes and a fairly significant drop in violent crimes, and our overall crime is down over 26% from this time last year when you do a month-to-month comparison. But that's not to say that there are people out there that are still being victimized. So report crimes if you are experiencing them. We're doing what we can to try to limit the exposure to our officers, to the general public, and to the general public to our officers. So you can call in to the, if it's a nonviolent crime, you can call in to our non-emergency line at 415-553-0123 and report crimes. You can also utilize 311 or utilize our website, because some crimes you can report online as well. We've stood up a call-in center for crime reporting to make it easier for the public to report those crimes. But again, if you have suffered a crime, we do need you to report it. If it's a violent crime, we definitely will be there, and we will respond to those crimes in person. Again, I ask everyone who's watching this, adhere to the public health orders, keep your distance, listen to what the professionals in our public health department and around the country is saying, and we will save lives in our city and our country. So I thank you in advance for your cooperation. And everybody, please stay safe and stay healthy. Thank you.
Question for Mayor Breed from NBC Bay Area. Earlier this week, you explained that the city doesn't have the resources to provide the kind of wraparound services needed to allow just any homeless person to a shelter in a city-leased hotel. Yesterday, 5 San Francisco supervisors made the argument that the city does not have, made the argument that the city does have the resources to do just that, so long as they can self-care. Are those supervisors wrong in their assessment, or are you wrong?
So let me just start by talking about Moscone West. We opened a day later, almost 400 shelter beds, because we didn't have sufficient staffing to cover what we know we need as it relates to those shelter beds, as well as other locations that we need in order to house people. It's not as simple as we can open up a hotel room, except for those who we know can basically self-care, people that we are working with in our shelter systems and other places. It's a real challenge because the fact is, if there is someone who is diagnosed or suspected of coronavirus, they have to stay in that particular hotel room, and we have to make sure that there are resources there, including food, the cleaning, the security to make sure that they don't leave those locations. There's a lot that goes into not only having the resources there, but making sure that the people who are working with other people, we have to also keep them safe. So we have to make sure everyone understands the protocols because social distancing applies in these shelters. Social distancing implies when people are cleaning and doing the other things that need to be done because there will continue to be challenges. But I want to be clear that we have a system by which we are focusing on making sure that we are helping the most vulnerable homeless population. And that is people who are in our shelters, people who are over the age of 60 and have underlying conditions, people who we know have no place to go or may live in a congregate setting and have no place to shelter in place. We have to prioritize those people, and that's what's most important. And we are hopeful that we will, of course, be able to do more, but it's going to require more money, more staffing, and there are going to be limitations in terms of what we're going to be able to not only cover, but what we're going to be able to get reimbursed for from the federal government. So it's a lot more complicated than what some are trying to imply, and this is why we have professionals in our public health industry. This is why we have departments where people have been doing this work for many, many years. The folks who are a part of the Emergency Operations Center, they are the professionals with the expertise and the understanding, the city attorney's office and others who have a knowledge of what we need to do, and we are putting what we need to do into place based on what we know we can deliver on.
Thank you. The next questions are for Dr. Susan Phillip.
I wanted to take a moment just to clarify, make sure that I once again said the numbers of cases across the city and people in the hospital, just in case I did not say it clearly the first time. So I want to reiterate that as of today, there are 497 San Francisco residents with confirmed cases of coronavirus. 60 of them, 60, are in hospitals across the city, and half of those are in ICUs. And of course, sadly, 7 San Franciscans have died from coronavirus. Thank you.
Thank you. Our first question is from Melanie Woodrow, ABC 7. California is 50th in terms of testing, with only Oklahoma testing fewer people than California as of this morning. California has a huge number of tests pending, close to 60,000 of them. Why can't California process these tests, and what is being done about this?
What I can speak to is the situation in San Francisco, and I'm sure that the people in leadership in the state of California and public health can answer the questions about the pending tests there. What I can talk about is what we are doing and how we've responded in San Francisco. Dr. Colfax and the mayor have talked about how we're working to expand testing, both in the testing sites that we directly work with and control at the public health laboratory at 101 Grove Street, and also at the clinical laboratory at Zuckerberg San Francisco General Hospital. In addition, we've had very strong partnerships with University of California, San Francisco, and UCSF Lab also has capacity to test. So what we have been focusing on as a department and a city is increasing our local capacity to test, and that has been where our focus has been. We do not have a backlog of tests for residents in San Francisco who are testing at the sites that we are working with. It's very important, and again, as the mayor and Dr. Colfax have said, everyone is facing across the country a limitation on the essential collection kits that are needed to do testing. So at the same time that we're increasing laboratory capacity, those tests in the lab are only as good as our ability to get the specimens from patients and send them to the laboratory. We're actively working on multiple ways of trying to allow for different types of test kits and different types of swabs to be used. So that is problem solving that is going on right now with the EOC and with the Department of Public Health laboratory experts and UCSF. So we are thinking of all the ways in which we can remove that bottleneck, but it remains a challenge. But we are increasing every week the numbers of tests that are available. And later today, we will have information available to the public so they can see our progress on testing.
Related to that, a question from Tricia Tandandi of the San Francisco Chronicle. How many tests does the Department of Public Health have every day, and how are you rationing and prioritizing those tests?
So again, the issue is not just the tests and the kits that we have at the laboratory, it's also the collection supplies. And we are working to really get our hands around the numbers of collection supplies, because in normal situations, pre-pandemic, many of these would be at clinics and other locations throughout DPH. So we're gathering all of that together to understand what we have. And then those test kits and the tests themselves will be prioritized based on where we see the most vulnerable populations. So for instance, we talked about Laguna Honda Hospital. We talked about how we are in discussion with CDC and California Department of Public Health, as well as our own experts about testing there. So as we are discussing and deciding on a need for testing, we will prioritize that population for the tests that we have. We continue to increase our capacity for testing. We are also bringing on experts to help us optimize the workflow and our ability to get the most out of the equipment and the people that we have, and bring on more people if necessary to add additional shifts. So we continue again to ramp up our capacity within the lab. We continue to work on making sure that we have more of the collection kits that are needed to do the testing. And we're also trying to partner and bring on kind of novel and new ways of doing testing with partners in sites that may be new and we haven't tried before, such as walk-up or drive-up testing. So you'll be hearing more about that in the coming weeks as well.
Thank you. Another question from the SF Chronicle. The number of those infected at Laguna Honda has remained at 12 for the past few days. Is that an encouraging sign that the city has the virus and the facility under control, or is it still too early to tell?
We believe that it is still too early to tell. We are taking this situation very seriously, which is why we are briefing the public about it on such a regular basis. And we have asked for expertise from CDC and from CDPH to be added to our own. So it is, we are glad that there have been only 12 cases identified. We continue to be thinking about additional patients and staff that might require testing. And we know that we have to be vigilant based on what we have seen in Washington State and other areas about how vulnerable patients within facilities like Laguna Honda are. And because of its size and its scope and just the sheer number of people involved, we want to be very cautious about how we proceed. So we are paying the highest amount of attention to Laguna Honda. It's encouraging right now that we have not seen more than 12 cases or people becoming very ill in the facility, and we need to keep that level of vigilance up, and we will do that.
Question from John Ruwich of NPR. Are you considering making mask wearing in public mandatory, and under what circumstances might that happen?
So I want to clarify that what we are talking about are not masks for the general public. We're talking about face coverings, and that can be any type of homemade cloth. That can be a bandana, it can be a scarf, it can be a gaiter for our necks. So it does not, we are not talking about masks. So specifically, isolation masks and N95 masks should be reserved for healthcare workers and first responders. The public should not be attempting to purchase and use those masks for this purpose. What we're trying to accomplish with covering our face is really decreasing the amount of unwittingly how we are potentially spreading virus particles to other people even if we feel fine, even if we don't feel very sick. So what we're doing by covering our face is actually protecting the people around us. At this time, to answer the specific question, we're not considering mandatory covering of face, but we are saying that this is a good tool, and we know that people in San Francisco have been, for the most part, really doing their part by staying at home, keeping their distance, limiting their outings to essential services, and we know that they've been looking for additional ways in which they can protect their community and continue to work on flattening our curve, as we all have been doing. So this is in addition to those very basic and important activities that San Francisco is already undertaking, but it's not mandatory at all at this time.
Follow up to that, have you personally started wearing a mask when you go out? And if so, when, what kind, and how has the experience been?
Yes, so I have started covering my face when I go out. I've used a scarf on some occasions. I do have an isolation mask, one that I'm using as part of the EOC, and the DOC as being an essential worker for the city and needing to come into work every day. I will tell you that if you do have a mask that you are using, if you are not just using a homemade face cover, do everything you can to extend use of that mask. I have had the same mask for 2 weeks that I've been using, and there's no need to discard it and have a new one every day. It's an odd thing at first. As we walk around the streets, though, we see more people are doing it, and we think it's going to become more the norm. Just the way in which San Franciscans are sort of giving ourselves the courtesy to move out of the way of each other, allowing that 6-foot space, and the masks will also be another reminder that life is not normal yet. As the mayor said, we're all looking forward to the time when we can go back to life in this amazing city being more normal. But for now, the face coverings are a reminder that we're not there yet. It's a reminder to keep our physical space. It's a reminder that we need to stay home as much as possible. And again, I don't want to overlook washing our hands and using hand sanitizer. That's one of the best things that we can also do in terms of keeping ourselves healthy and others around us.
Last question for you, Dr. Phillip, from Goran Zanti of the New York Times. How many ICU beds and ventilators have been made available in San Francisco, and will the city's hospitals be securing more of them?
So in San Francisco, advanced planning has been going on for weeks, very early in our planning as a city. And as the mayor has said, through her leadership, we declared an emergency very, very early on February 25th. And since that time, there have been teams that have been doing advanced planning for ICU availability and for beds. We are going to later today have up information available to the public about just that, because we know people are very interested in hospitals, capacity, and surge. We currently do not need to use any of our surge capacity. As we said, there are 60 people that are hospitalized throughout the city with COVID-19 at this time. About 30 of those are in ICU. That is well within our capacity as a city. And so, the full numbers about our percent occupied and all of that will become available later. And as we get more information, additional information will become available and will be shared. So there's ongoing planning about surge. There's ongoing planning about how we would accommodate that. There have been requests that have been put in by the mayor to secure additional ventilators and additional surge capacity. But that planning has been going on for a very long time in San Francisco.
Thank you. The next questions are for Abigail Stewart-Kahn.
As I get started here, I want to introduce myself. I'm Abigail Stewart-Kahn. I'm the Interim Director of the Department of Homelessness and Supportive Housing. And before I respond to questions, I wanted to note a couple things. This pandemic gives us the opportunity to deeply understand that housing is healthcare, and that is clear now more than ever. And thanks to the leadership of Mayor Breed before this crisis hit, she supercharged our homelessness response system with expansion. And as I was visiting many permanent supportive housing and shelter and navigation center sites yesterday, I saw that people who are formerly homeless and are housed, 9,000 every year in our city, are safer because of that housing. Immediately after the homelessness response, after the coronavirus became evident, we pivoted our entire homelessness response system to care, prevention, and response. And echoing Mayor Breed's note about positivity, our system of care is tremendously grateful to our HSH staff, to our guests, tenants, and clients, and people living unsheltered in our community, to our partners, our city partners and nonprofits, and to our community. We see you out there thanking us. I know my family's been out at 7 o'clock at night cheering with their musical instruments and putting signs in their windows, and that is deeply helpful to all of the amazing frontline workers working in the homelessness response system.
First question from Sarah Ruiz Grossman of the Huffington Post. What is the current number of homeless people that have been moved into hotels?
That's an excellent question. So at the direction of the Department of Public Health, the first hotels have been used for people coming out of hospitals and medical care to when they don't need to be in the beds. You heard that from our deputy health officer earlier. Trent Rohr provided an update that it was approximately 120 people. 90 to 95% of those individuals are homeless or formerly homeless. That number increases a bit each day, but will also decrease as those individuals, through the direction of public health, have completed their isolation or quarantine period and are able to move to other locations.
When do you expect more will be moved in? How many total? By when?
Yeah, that's a great question. So let me be clear. From the beginning of this issue, the mayor and all of the leadership of the city has put housed public health, unhoused public health, and unsheltered public health on equal footing. This is a public health response. And our sheltered and unsheltered population have been on the list of people who are receiving services from day one. First from our hospitals, and these are the individuals who are now in our hotels. And now in the coming days, we will be standing up hotels with the support of the Human Services Agency, who is responsible for mass care and shelter, to rapidly expand that hotel capacity. They have already obtained those hotels, and we are pivoting to move to to staffing, supplying, and transporting those individuals. As the mayor said very clearly, we are beginning this process with people who are vulnerable to COVID among our homeless population. We hear you, and we know that being homeless makes you vulnerable, and we need to start somewhere at the direction of the Department of Public Health. That is people who are over 60 or who have an underlying health condition that makes you vulnerable to COVID.
Question from Janie Har of the Associated Press. I know you have a priority on public health and keeping hospital beds open, but would families with young children or pregnant women be eligible for the hotel rooms you've been talking about?
Thank you for that question. We are spending a tremendous amount of time on our single adult population, and I want to reassure the community that our staff and all of our partners are working tirelessly with young people experiencing homelessness and with families. And let me talk a little bit about how that looks in a family situation. San Francisco, under the mayorship of Mayor Breed, attained what's called a functional zero in unsheltered homelessness. And we've been able to maintain that through this COVID virus. That doesn't mean that somebody won't become homeless tonight. It doesn't mean that somebody is sleeping in their car and not wanting to come into shelter. What it means is that we have the capacity to take them in when we outreach to them and they say yes. That continues today. People can come, families, women who are pregnant can come indoors immediately into a congregate setting and through a partnership with the Human Services Agency, increasingly to hotel rooms through CalWorks programs and additional hotels coming online.
Last question for you.
question from Kathy Novak of KCBS Radio. Could you provide an update on how many people from the Division Circle Navigation Center have been moved to hotels, and what is the plan for the rest of the residents at that navigation center?
Yeah, thank you for that question, and to the entire community, thank you for your compassion. I'm going to use the opportunity to speak about the full response of the city to our first COVID positive individual who had been staying at a navigation center. Immediately upon learning of the diagnosis, the shelter site was supplied with additional masks, and guests and shelter staff are wearing them at all times. The Department of Public Health also initiated contact tracing to identify who that patient, we call them guests, he has become the individual, excuse me, I'm not actually sure we should share what the gender is, it has initiated contact tracing with the individual who is now a patient and is in very good condition. And that allows us to understand who is considered exposed, vulnerable, and so on at our site. In response to the positive test, the Department of Public Health rapidly deployed a physician and health workers to the shelter site to conduct symptoms and temperature screening beyond what was already in place in our system of care for all guests and staff. Any guests demonstrating symptoms consistent with COVID-19 will be tested for COVID-19 and relocated to staffed quarantine rooms immediately. Other guests will be moved to hotel rooms based on their risk of exposure and risk of the disease. Staff at the shelter will also be provided with medical support and space to self-isolate or self-quarantine if needed, and we're deeply grateful that they are considered healthcare workers in this situation. The city is deploying a professional cleaning crew in addition to the cleaning resources led by Mayor Breed at the beginning of this epidemic, and that is ongoing. DPH staff continue to be on site and will answer staff and guest questions. The site management will continue to guide social distancing protocols and implement shelter health screening protocols. I am with that community. Division Circle is very near my children's school, and it's a very favorite spot of mine. But it's very important that we understand that this isn't a place that those of us who aren't staying there should be visiting. We bring our germs to people experiencing homelessness when we try to show up and help. So you can help by going out and cheering for people on the streets. You can help in all of the ways that you are donating, but please don't try to enter the site. It is not allowed at this time. That is reserved for the guests and the staff there. And thank you for your compassion for that community.
And final question, have people started moving into the facility at Moscone West?
It's an excellent question. That is happening today. As Mayor Breed said, standing up a shelter, as we know because of Mayor Breed's 1,000 shelter bed challenge, is no small feat. And we need to do this with care, ethics, and compassion, even in this crisis. We need these sites to be successful for people to want to stay inside and shelter in place. Thanks to the leadership of the Human Services Agency, we are rapidly expanding our congregate sites, and people will be moving in there today.
Thank you. The next questions are for the chief. Chief, a question about the citations you referenced. How many people and businesses have been cited, and are these misdemeanor citations?
Let me start with the businesses. We have taken 6 incident reports for businesses that were non-essential, that should have been closed and weren't. And one of those 6 had to be cited. And as I said, we have stated publicly that our enforcement posture is progressive, where we educate initially. And sometimes at the beginning, we educated more than once, and we still do everything we can to educate. With the businesses, if they're not supposed to be open, we ask them to be closed, because the bottom line is we're looking for compliance. This is not a test or race to see how many people we can cite. What we're trying to get at is compliance. So when the business is closed, we take an incident report, and those reports can lead to either a criminal action or a civil action. So the people that will review those cases will make that determination. If we have to come back, we're citing, particularly with businesses. With the individuals, there's been one individual that was cited. And as I said, we just put out our enforcement protocols about a week ago that we vetted through our city attorneys. So again, we're looking for compliance. And by and large, most people, when they're approached by a police officer, will comply. That's what we've seen. That's the trend that we've seen. But there are some areas that are stubborn. And we have to go back and keep going back. But we're after compliance. And if we have to use citations and enforcement at the highest degree to get there, then that's what we'll do. But for the most part, I want to emphasize the positive. Most people in our city have been compliant.
Thank you. That concludes our press conference.
Thank you.